Hi, this is the McIver method. My name is Megan, and I am going to be teaching you about medication administration today. So, what type of medication administration are we going to be going over today? The fun and exciting IV medication. Now, there are two kinds of IV administration. The first kind of IV administration is IV push. And we'll place that over here. When we're doing an IV push medication, this can be for all sorts of reasons, like we're giving levothyroxine, which is the thyroid medication for hypothyroidism, also called Synthroid. And a lot of times this is given in hospital settings when they haven't established a G-tube and they need to give their daily dose of Synthroid, and the patient is intubated or can't swallow for some reason, so they need to do an IV push medication. So the first thing that you're going to do when you're giving an IV push medication is you are going to get and use a 10 ml sterile syringe with a large gauge needle that you attach. I prefer 18 gauge and larger, which would be a 16 or 14, because this will allow you to withdraw the medication from the vial quickly, and that will preserve your time. So you are going to use a 10 milliliter sterile syringe with a large gauge needle, preferably an 18, to withdraw the medication from the bottle. So your next step is to withdraw that medication. Okay. Once you've pulled all the medication into your syringe, you are going to remove the needle from the syringe. And this is because most IVs have gone needleless. They are connected, a syringe is connected to IV tubing via what's called a lure lock. A lure lock, the syringe will plug into the port. You've got your male and your female ends, and this is your IV port. It will plug in, and you will twist and screw it on and administer the med straight in. And then you will twist and pull it off without ever having to use a needle. It's very, very cool stuff. So, once you've removed the needle from the syringe, discard needle. All right, and then as said, you will attach the syringe to an IV port, and you have multiple ports on one IV line, so you can pick any port and push the med per medication guidelines, which I say is usually over 2 to 3 minutes. I will say that it is dependent upon each medication, how long it takes you to push them, and I will give you your one helpful hint of advice today, which is never, you'll sound so smart when you say this in class, push potassium, you will stop a heart. We'll do your little, there's the other part of your heart. You will stop a heart if you push potassium through an IV line. I don't care how fast, how slow you push it, you will stop the heart. You will kill your patient. Dead. Gone. So, we've learned some important things about the IV push. Let's talk about the other way you can give an IV medication. Which is the IV drip. So, IV drips come in one of two fashions. They are pre-made, all done up. A lot of times vancomycin will be pre-made. Ceftriaxone, all these will likely be pre-made depending on your institution. Or you will get to dilute and mix your medication per pharmacy standard guidelines. So, either way, whatever medication, whatever way it comes, is going to lead you to this ratio. Volume over time. An example of this is 250 mLs over 1 hour. This equals your rate. So when your attendant comes over and says, "Oh, what's the rate for the vancomycin?" You can say it's 250 an hour, meaning 250 milliliters are flowing into that patient per hour. Okay, so let's draw us a patient. As you can see, my drawing skills are renowned, world renowned. And we'll put, he's got 2 IVs going right now. We'll say this is number 2 and this is number 1. Let's say we're deciding to hang bag number 2. And we've got some questions about how we're going to hang this medication. So here's our first IV line, swirling down and around, and finally into the patient's hand. So here comes IV number 2, and our first question is, do we need specific tubing for med number 2? And a great example of this would be nitro. Nitro has a very specific tubing that comes with it, and it should usually be supplied by your pharmacy. Any kind of medication that has specialty tubing is usually supplied by the pharmacy. That being said, if it's a medication you've never seen before, never given, call pharmacy, say, is it all right to give this through standard tubing? And they will give you a great answer once they look it up. So, the next question is, what happens when I combine these medications? So, we'll point an arrow here, and we'll point an arrow here. Are meds compatible? Now, if you were to put 2 medications together that flowed finally into the same line before flowing into the patient, you run the risk of non-compatible meds. What this means is that you will see little like salt granules almost forming in the IV tubing before it hits the patient. Now this is extremely toxic to the patient usually, and it will clog your IV tubing at some point. So it's always important when you're about to hang another bag of fluids or medications that you always check and make sure the medications are compatible. Who do you check with? Pharmacy. They are going to be your best friends. So the next question that comes up is maybe your patient has this IV and this one goes, this one goes into this hand, and this one, poor guy, is going to go into that leg. Which IV tubing do you use? Or do you start a fresh bag altogether? So, your last question is, which IV access point do I choose? Now, this is a lot of times going to be a lot easier for you because the patients that you'll deal with, unless they're ICU, are going to have maybe 1 or 2 IV medications that are drips, and they will hang at different times. So you won't run into this problem as much, but if you do get into the critical care units, this is going to be a big deal for you. IV access points are determined upon the medication that you're giving and its necessity in the clinical setting. So if it's a pain medication, I will tell you that choose a far point from the patient. And if it can go solely in its own dedicated line, that's great. If not, pain medication can usually be mixed with most other medications and it's not a problem. Medications like insulin, however, your insulin drips have to have their own dedicated line. And why is this, you ask? It's because you never want to push insulin. Or potentially mix it with something where it's being pushed too quickly into the patient, thus dropping their blood sugar too low. So which IV access point is going to come a lot with time on the unit, asking other nurses where they're hanging their drips, where they're hanging their antibiotics. But hopefully you'll be in a unit where you're on the regular floor and you don't have to deal with too many IVs hanging. So the next question is, how do you do the IV drip? So first things first, get a little dot here. You're going to spike the bag, which literally means putting the IV tubing, taking this part and shoving it into the bag so that it flows back down into the tubing and into the patient. We will go over how to spike a bag in a later tutorial. The next part is you are going to attach your tubing to the patient via an existing IV line or a new line. Let's say they wanted to start an IV insulin drip. This would be the time to practice your IV skills and get another line into the patient. Now there are 2 methods to choosing how you're going to give this rate to a patient, to assign a rate to an IV. The first one is called a dial a flow. No, I did not make that up. That is really what it's called. So basically what you have here is you have your IV, and here comes the IV line. It's going to go into this chamber. It's going to go through this chamber And you're going to have like 150, 160. You're going to have different rates. And these are usually denoted in milliliters per hour. Okay? And then you will turn this. You'll turn it like, you'll dial it in. See how my Sharpie's turning around? It'll turn just like that. You'll select what rate you want it to be on, 150, 160. In this case, our rate is 250, so we dial it to 250. And that's going to allow your medication to flow out at a rate of 250 mLs per hour to the patient. The other method we have, and I'm running out of room here, but it is the wonderful IV pump. And you will dial in a rate, and it will program it and do it all for you, and then beep when it's finished. IV pumps are very nice. All right, this is IV medication administration. Thanks for watching.